Sarah's hands trembled as she reached for her locker. After 15 years as an ICU nurse, she never thought she'd be here, contemplating walking away from the career she once loved. But the relentless pressure, emotional impact, and grueling hours had taken their toll. Sarah isn't alone. Her story echoes through hospital corridors across Europe and the Middle East, a silent crisis threatening the very foundation of our healthcare systems. Let's face it, behind the facade of what looks normal in a hospital, there lies a different story. Imagine walking through a bustling hospital. Look closer, and you'll see the signs. A young doctor staring blankly at a computer screen, overwhelmed by mounting paperwork. A nurse rushing between patients, skipping meals and breaks. An experienced surgeon, hands steady but eyes weary from another 16-hour shift. The WHO European Agency warns of a healthcare system's collapse if we don't act now. Their director is quite straightforward about the situation. These threats represent a ticking time bomb which, if not addressed, is likely to lead to poor health outcomes across the board, long waiting times for treatment, many preventable deaths, and potentially even health system collapse. These are the faces of a workforce pushed to its limits. Recent data paints a dark picture. 91% of healthcare workers report stress, 83% struggle with anxiety, 81% suffer from exhaustion. In the Middle East and Africa, a staggering 42% are considering leaving their positions. This isn't just about burned-out healthcare workers, it's about you, me, and everyone who might need medical care. When our healers suffer, patients pay the price due to more hospital-acquired infections, increased medication errors, more frequent patient falls, lower patient satisfaction. And the financial impact? It's huge. Each time a doctor quits in the US, it costs a hospital at least $500,000. For nurses, it's about $40,000 per resignation in Europe. But amidst the darkness, there are glimmers of light. Meet Marie, a nurse manager at the University Hospital of Geneva. A year ago, she faced skyrocketing turnover rates and plummeting morale. Today, she tells a different story. We implemented a comprehensive well-being program that seemed expensive at first, Marie shares, her eyes bright with enthusiasm. Within a year, we saw a 30% reduction in burnout cases, 25% improvement in staff retention, and 85% of our team reporting better work-life balance. The healthcare crisis isn't just about staffing shortages or budget cuts, it's about people, and it's time we put those people first. Because when we take care of our healthcare workers, they can take better care of us all. As we stand at this crossroads in healthcare, the choice is clear. We can continue down the path of burnout and crisis, or we can chart a new course, one that values, supports, and empowers our healthcare heroes. Want to learn more about how leading healthcare organizations are transforming employee well-being and revolutionizing patient care in the process? Then stay tuned for our comprehensive guide, coming soon. It will dive deep into innovative strategies, cultural transformation, and the role of technology in creating sustainable, resilient healthcare organizations. The future of healthcare depends on the choices we make today. Let's make them count.